All right, so we've just seen how the child's brain is well equipped to imitate the actions of others. You recall children over-imitate, and we can think of that as a kind of an expectation to be taught, but also the children want to be like their teachers, the members of their group, right? So there's a sort of there could be a social motivation there as well. But of course, we don't just go around imitating each other, though, right? So clearly, while we have the capacity to imitate, we don't do it all the time. And one way to try to understand that is to think about people who have damage to certain parts of the brain, especially up in the frontal lobes here. They have an interesting set of symptoms. So some prefrontal lesions can cause what neuropsychologists call environmental dependency syndrome, where these patients spontaneously imitate actions done by others. It's as if they might perceive somebody doing some action, and their mirror system is going to do what it normally does, is activate the similar motor programs. But then what is happening in these patients is they actually go ahead and perform that action. They imitate it. Whereas normal people don't go around just imitating every gesture that another makes. These folks do. Well, that suggests that whatever part of the brain that was damaged then may be acting like a braking system on the automatic imitation system. So the current thinking is that this mirror system kind of operates in an automatic fashion in normal people. The perceptions can trigger some of these motor systems, but normally we don't carry out the action due to the influence of other brain areas that would be inhibiting the action. But if there are lesions in that area, damage to that area can then sort of take the brakes off and allow the automatic mirror system to carry out actions. That would be an explanation for some of the symptoms of these lesion patients. So not only do these folks imitate gestures by others, but they will, just as we were kind of suggesting before, they will even perform actions with objects that they see, and they will do this automatically. So you recall that in the last lesson we talked about how kids learn that when you see a ball, that they've learned to kick the ball, and so just the sight of the ball can trigger the motor programs for kicking, even if the kid doesn't always go through that motor program because they're inhibiting it. But nevertheless, the mirror system is involved. So too, these patients with prefrontal lesions, even when they just see an object in their environment, they will sort of automatically perform the standard behavior with that object. They see the hammer on the table, they pick it up and they start hammering. They see a cup, they reach for it and put it to the mouth. In other words, objects have what psychologists would call certain affordances. An affordance is what is typically done with that object or to that object. And because we grow up in culture and we learn all kinds of actions with different objects, right, the actions and the objects get linked in our brain. And for these folks who have damage and they can't put the brakes on, it's as though when they see the cup, it's triggering through the mirror system, it's triggering some of the motor programs that are stored, the types of programs, the kinds of things you do with cups, you pick them up, put them to your mouth, and that flow of information is uninterrupted. It can't be braked because of the damage. And so these patients will just see objects and then use them in a way that they have used in the past. So again, that supports this picture of an automatic mirror system linking perceptions and actions. Very useful for understanding other people's actions, very useful for imitation. And the lesion data supports this view that this is an automatic system, but that can be stopped, right, at the output level. We can crank up our mirror system, but we won't necessarily perform the action that the mirror system has stimulated here.